Good evening, everyone. I am Richa Sehra, founder and editor-in-chief Responsible Hospitals, and I would like to welcome all of you on our Insta Live channel today. So today's topic is all about infertility. I'm sure a lot of women are being facing these kind of issues these days, and we will be talking about in deep with Dr. Kanchi Khurana from Chandigarh. She will be talking about in depth from there. So I'll just try to connect with her ASAP. So in case any of you have any kind of issues which are related to it, can just log in, can just let me know. I would ask and try to take that question within the chat frame. So infertility is nothing but it is the process wherein we need to understand that why the conceiving part is not happening. And I think it is very important for us to understand that how it is affected our health, how we can go about it. So I think we will be deeply talking about it very soon with Dr. Kanchi. She is an obstetrician and gynecologist with Cloud9 Hospital Chandigarh branch, and we will be just taking some few questions right away, and the other questions probably we can take it ASAP. I've got her ID. I'm just trying to add her up. Just a second, guys. I'm just trying to add her up, and then probably we can start the session soon. Dr. Kanchi, if you can just see me or hear me, just let me know. I can see a request from Anjali Goyal. I think that's a different person. Let me just try and add Dr. Kanchi. Dr. Kanchi, are you there online? Can we just start the session? Okay. I've got her an ID, and just a second, I'm just trying to add her up. Kanchi Khurana 11, yeah. I've just sent you a request. Probably if you would have received, please let's start the session. If not, just let me know while the live is going on. Can you hear me? Are you there online? Team, I'm just trying to send her a request on the same ID which is given to me, but I'm not. Well, I don't think she's online. Let me try it once again. Yeah. Immediately starting the session soon. Good evening, Dr. Kanchi. How are you? Can you hear me?
Hi, hi.
Hi, can you hear me properly?
Yeah, hi.
First of all, I would really like to welcome to you on our Insta channel.
Thank you so much. Thank you, Richa. Thank you.
Thanks. So, Dr. Kanchi, today's topic is all about infertility, and I'm sure a lot of people and women are facing such challenge, and I think it's a great platform to talk about it in deep. So, I think you are the best person to talk about. And so, to start with, I would start with what is infertility in your language? Maybe any any person who is a layman should be able to understand the exact what is it infertility, because this terminology is being used very commonly these days, but I'm sure there is little unclarity about it. Maybe if you can just start with that first.
Yeah. So, infertility is basically not able to get pregnant despite having regular timed unprotected intercourse for approximately a year, right? So,
Okay.
so most of the people will always have the strong desire to become pregnant once in their lifetime, basically. So, understanding what is actually normal fertility is very crucial in helping to decide to decide for a couple to know whether it is time to seek help or no. So most of the couples will be able to conceive, 85% of them will be able to conceive within first year of their marriage. Rest 7% more will be able to conceive up in second year of their marriage. But those 15% who are not able to conceive within their first year of marriage after having regular unprotected intercourse are infertile. So this is infertility basically.
Sure. So, since we've just spoken about what infertility is, I think let's move to the question wherein we would want to know that when should be considered as a situation, or when do we land up saying that there is an infertility issue? When do they start thinking on it, and when should they start taking a help or get serious about it?
Yeah, right. So as I said, that infertility has is come to be defined when the couple is not able to conceive within the first 12 months of their marriage. So the
Mm-hmm.
15% of the couples attempting to conceive during their first year of marriage and are not able to conceive, we recommend them to seek the help of an infertility specialist because their pregnancy has not occurred within first 12 months. Also, there are various scenarios where we ask the couple to seek help earlier as well. So these scenarios include, number one, if a woman is having per se infrequent or irregular menstrual periods. So then we do not say that you wait for 1 year of marriage and then if you're not able to conceive, then you consult your infertility specialist. So if you are having infrequent menstrual cycles, yes, 6 months you can try, and then after 6 months you need to consult your infertility specialist. Second scenario is when the female age is more than 35 years of age. So
Okay.
when the female age is less than 35 years of age, we recommend to try for approximately a year. But if the age is more than 35, we recommend that 6 years of intercourse, 6 months of regular intercourse and not getting pregnant, you consult an infertility specialist. Then if a female is having a history of prior pelvic infections, like infections are very common, the females complains of discharges and pain during relations, pain lower abdomen and all. So if they have a diagnosis of pelvic infections per se, they need to consult the infertility specialist because the pelvic infections usually lead to the blockage of tubes. So they need to consult earlier. Also, if a female is having a uterine fibroid per se, or some females have endometrial polyps, they also should consider an early seeking of advice. Also, so there are few people who have known male factor infertility, where they know previously that the semen analysis of the male partner is abnormal. They also should consult their infertility specialist in a span of 6 months. So these are the basic scenarios in which we advise to consult your infertility specialist earlier. Otherwise, 1 year of unprotected intercourse and not able to conceive is fine, and then you seek help of the infertility specialist.
Sure. And since we have been just talking about that woman side, is it like the men is also equally responsible, and is it also, affected by men?
Yeah, of course. Obviously, if we when we talk about the how much infertility is rampant in our country, so when we talk about the causes, how much female factor causes the infertility and how much male factor causes the infertility. So
Yeah.
when we talk about only female infertility, 30 to 40% of the couples suffer from only female infertility. 30 to 40% of the couples will only suffer from male infertility. And
Okay.
20% of them will suffer from unexplained infertility. So the male infertility is causative in approximately 40 to 50% of the cases. And if we talk about sole cause of infertility, then it is 20 to 30%. So usually, how do we seek advice for the men who suffer from infertility? We do a basic semen analysis for a couple, for a male partner, and if it is abnormal, we repeat it after few days. And if that repeated semen analysis is also abnormal, then we confirm the diagnosis of male infertility. So male equally is responsible for infertility, and not only the female partner is responsible.
Sure, sure. So since you've just mentioned about that they are equally responsible, and they shouldn't mind getting it checked. There is no problem, because
Yeah.
these days there's a lot of awareness in the society, and there was a time when woman was like, she was like pushed,
Yeah.
and she was not treated the same way like the other women. I think these days the males have come up and they're quite aware. So I think
Yeah.
it's really important for both the couple, both the people to understand and go to a doctor and understand the reason
Yes,
behind
exactly.
it. So since you've just mentioned about the what are the reasons, what do you think, what is the exact reason or what are the more reasons which certainly land up in the infertility situation?
So, before telling you the reasons for infertility in women or men, actually, we should know what is the basis of reproduction in both men and women. So,
Sure.
understanding the basic of reproduction is very important before knowing the causes of infertility in both the partners. So, what happens naturally is in a female partner, we have a uterus, we have two fallopian tubes, and then we have two ovaries. So what happens is in each cycle, in each menstrual cycle, one egg grows to a particular size. Once the egg grows to a particular size, it gets ruptured by the hormones inside the body. The tubes pick up that egg from the ovary. Once they keep relations during that time, when once the egg is ruptured and is picked up by the fallopian tube, the sperm will travel from the vagina, from the uterus to the fallopian tube. One egg and one sperm will fertilize in the fallopian tube. They will form an embryo, and that embryo will grow for 4 to 5 days in the tube itself. After 4 to 5 days, it will come inside the uterus, gets implanted in the uterus, grows there for 9 months, and takes a form of a baby. So, this is the basic of reproduction. So, once we
Mhm.
know the basic of reproduction, now we can understand what are the causes of infertility. So the
Right.
causes can be divided into the female causes and then the male causes. So this is
Right.
what is happening in the female partner. In the male partner also, what is happening is as the females have the ovary, the males have testis. The testis will produce sperms. The sperms also, the control of the formation of the sperms in the testis is regulated by a gland in the brain of ours, which is known as pituitary gland. So the pituitary gland will give some signal to the testis, and the testis will start producing the sperms. These sperms from the testis travel from the vas deferens to the bladder, and from the bladder they travel to the penis, and then this sperm lands up in the semen and it comes out of the penis. So this is the normal thing which is happening in the male partner. So if we now talk about the causes, what are the causes of infertility in women and then men, we will be better able to understand them. So now coming to the female partner, if we talk about the causes in the female, so as the pituitary gland is in the male brain, similarly a pituitary gland is also situated in the female brain, which will give signal to the ovary and the egg will start forming. So the first cause of infertility in female partner is any problems in the pituitary gland or any hormonal imbalances which will not allow the egg to grow in the ovary. This is the first cause of female infertility. Now coming to the ovary, because the brain has given signal to the ovary for egg formation, if it is normal, we have to see whether or not ovary is fine or not. So what happens is some females are suffering from cysts, or some females might be suffering from endometriosis. So endometriosis is a disorder in which what happens is the lining of the uterus, jahan se hame menses aate hain, the same lining grows outside the uterus in the fallopian tube and the ovary, and it starts to grow into a uh, खून का cyst, which we call a endometrioma, right? So this also then will cause infertility. Also, some females might have had tuberculosis or have had few previous infection, mumps, etc., जिसके कारण उनके एग्स जो हैं ओवरी में कम हो जाते हैं. देन एडवांस मेटर्नल एज, जैसे जैसे फीमेल का एज इंक्रीज होता है, राइट, एज द एज एडवांसेस द quantity of the egg decreases. So when the quantity decreases, the quality of the egg also decreases. So this is again causing infertility. Then if we now coming to the tubal part, so few infections in the female partner, it might be tuberculosis, it can be endometriosis also other pelvic infections, that chlamydia, gonorrhea, or sexually transmitted diseases. These lead to tubal factors, tubal occlusions, मतलब tubes जो है हमारी खराब हो जाएंगी, and egg and sperm will not be able to get fertilized, and this will cause infertility. Now coming to the uterus, if we talk about the uterus, some females might have fibroids, or some females might have adenomyosis, or some females might have endometrial polyps, or some infection, tuberculosis, or other pelvic infections. These cause problem in the uterus, and it will not lead to implantation of the embryo in the uterus. So this will lead to infertility in women. So these are the causes of infertility in the female partner. If we talk about the male partner, similarly, problems in the brain, problem in the hormonal imbalances will lead to impaired sperm production. Then if we talk about the testicular factors, that some males smoke heavily, some males take alcohol very badly, or if they have had a previous history of surgery of the testes, or if they have had an tubercular infection or mumps, or some males may have had a cancer for which they might have got radiotherapy or chemotherapy. All these things will lead to impaired sperm production. Some
Okay.
males might have problems in the vas deferens and the tubes which are connecting the testis and the bladder. So the tubal occlusions will also lead to infertility in them. And then there will be people who will not be able to keep relations properly, and there will be problem in ejaculation, there will be problem in erection. So these causes also lead to infertility. So these are the basic reasons which lead to infertility. I think
Sure.
I'm quite clear in that.
Very, very clearly. Yeah, very clearly. So, Dr. Kanchi, I think going ahead, just adding to this, another question comes out since you have just mentioned about the causes and the reasons. So, I think what are the treatments which are available for it? Any specific medications, or you think what all are the ways out?
Yeah. So, if we are talking about the treatments, we have to treat the cause. So, the cause of infertility is to be treated basically. So, if we talk about number one cause, which is the hormonal imbalance. So, if we know that a female or a male partner is suffering from infertility due to the hormonal cause, we need to treat the hormonal balance itself. And the treatment of the hormonal balance will make them normal, and they might be able to conceive. So there will be few medications, or there will be a few injections by which their hormonal balances will be retained and they will regain their fertility.
Okay.
Then if we talk about the hormones, if we are talking about the hormones per se or the tablets, so people will want to know what are the tablets or what are the injections which we give by which we restore the fertility basically. So if we are talking about the tablets which are given to restore fertility, number one is ovulation induction inducing agents. So there are two drugs. One is clomiphene, one is letrozole, which is most commonly given to stimulate the ovary and to produce the eggs. There are few hormonal imbalances, like the females who are suffering from PCOS. What happens is they are not able to form egg in their menstrual cycle. So once we give these tablets, clomiphene or letrozole, they are able to form the eggs. And once the egg is formed, we know that the egg has been formed. We give few injection to rupture the egg, and we ask them to keep relations during that time, and their infertility gets treated. So this is the basic fundamental of treating the infertility. Now there will be few people who will not be benefiting from this treatment. So what we do for them is we give them ovulation inducing injections, which are known as gonadotropins. If people are benefiting from drugs, well and fine. If they're not benefiting from the drugs, oral drugs, we give them injections which are known as gonadotropin. So these are the hormonal injections basically which are produced by the brain, and the brain is not able to produce these hormones, so we are giving it from outside. Once we give it from outside, the ovary starts producing eggs, and then again we can tell them what is the right time to keep relations, and then they can have a baby. But there will be another set of people who will not be benefiting from this issue. Then we have another method which is known as IUI, which is called intrauterine insemination. So the basic of intrauterine insemination is that the female partner should be fine, the female partner should be able to produce an egg, and the fallopian tubes also should be fine, and there might be some problem in the male semen analysis. And what we do is we wash the sperms. Once after washing these sperms, we keep it inside the uterus of the female partner. And here, by this procedure, approximately 20 to 30% of the couples will be able to get conceived. But now there will be another set of patients who will not benefit from IUI as well. Then there is IVF. So the IVF was basically discovered for patients, or invented for patients basically, who were having tubal factor infertility. Because अगर ट्यूब्स खराब होंगी तो एग और स्पर्म का फर्टिलाइजेशन नहीं हो पाएगा. So the doctors thought that अगर एग और स्पर्म का फर्टिलाइजेशन नहीं हो पाएगा तो कैसे प्रेगनेंसी आएगा. So what they did was they got an egg, the ovary itself. They got sperms from the semen of the male partner. They fertilized the egg and sperm outside of the body. They formed an embryo outside the body, and then they kept that embryo in the uterus. So this procedure is known as IVF or fertilization. So all the patients who are having tubal factor infertility, जिनके ट्यूब्स ठीक से काम नहीं कर रहे हैं, नंबर वन. अनदर जिनका एग ठीक से नहीं बन पा रहा है, जो दवाइयों से नहीं बन पा रहा है, इंजेक्शन से नहीं बन पा रहा है, they benefit from IVF. Then the patients who are having problems in their male semen analysis, so if the sperm count is very less than 10 million, they benefit from this IVF procedure. Or the males who don't have sperms in their semen altogether, they also benefit from this technique, which is known as in vitro fertilization. So the IVF will benefit that set of patients who are not able to conceive after ovulation induction or lifestyle modification or intrauterine insemination. Also, one very important thing is for the treatment of the patient is patient education. So most of us, most of normal people, most of my friends do not know what is the right time to get conceived.
Correct.
So making people understand, I strongly believe that educating people about normal process of fertility, problems which are affecting fertility, and then giving them the treatment options, empower them and make them and help them to make best choices. So once we understand the normal reproductive process, it will be essential to know when do we need to actually seek help. And once the people understand what their problem is, then they can decide for themselves what is the best option for them, what time they have kept for this thing, and then they can opt for various options accordingly.
Done. Which is why I think my last question to you was only the same, that what could be the main tips you would want to give it to the women who really want to avoid infertility position?
So I'll tell you three main factors which are affecting the fertility in women these days. One is age, one is stress, and the third is lifestyle. So because in early 90s, if we can say in early 90s, 1900s or late 1900s also, the females were conceiving in their teens or early 20s. So there was no problem in the conceptions per se. Because we didn't know that age can actually affect the fertility. So once a female increase their childbearing age to 30s and 40s because of their careers and all, and then we got to know that the advanced age is affecting the quality of the egg. What are the causes by which it affects the quality of the egg? We do not know. These are unsaid and unheard reasons which we also do not know. But increased age is causing the quality and the quantity of the eggs to decrease. So if we want to improve the quality of the eggs, or if we want to retain whatever eggs we want to have, number one thing is we have to maintain a healthy lifestyle. We should reduce the caffeine intake, which we actually do. We should stop smoking and decrease the quantity of alcohol to a very small amount. We should maintain healthy habits, healthy diet. By healthy habits and healthy diet, I do not mean that you stop some set of foods or stop actually eating anything, but you should maintain a healthy lifestyle. maintain an activity, maintain some exercise, do some yoga, do some meditation, whatever helps you relax yourself, do those things. Number one, this is very important to decrease the chances of infertility. Number two is stress. So stress is a very important factor which is actually decreasing the number of eggs in the early 20s as well. So we have started to see women who are in their early 20s and then still they are not able to conceive because they have their egg counts decrease, and the cause of that decrease egg count is stress as well. So because we have such careers which actually involve a lot of stress in our daily routine life, so this is also affecting us.
Yeah.
And actually we should seek help to decrease the stress. So psychological counselings are very useful in that front. We can always hear music, we can dance, we can do whatever we like to do. We should go out, we should take a walk, we should talk to people. Talking to people also reduces the stress. So number two is reduce the stress of yours in your life. And number three is lifestyle. So what is our lifestyle today? Most of them are working in IT companies, and they will sit on their laptops 12 hours a day and they'll not do anything and do their work only. So what will happen is that the body will dysregulate the hormones and it will cause infertility. So please maintain a healthy lifestyle. Get up slightly early. अगर आप 8 बजे उठते हैं तो आप 7:30 बजे उठ जाइए. अगर आप 7:30 उठते हैं तो आप 7 बजे उठ जाइए. And give that half an hour to yourself. Go out for a walk, do some form of exercise, do yoga, whatever you want to do. So improve your lifestyle, improve your eating habits. So if you're not having your breakfast, try to have your breakfast on time. Having your lunch on time, try to have your lunch on time, dinner on time, and take proper 8 hours of sleep per day, which is also very important to maintain a healthy lifestyle and improve the fertility per se. So these three things are actually very important and we should actually follow them, and I think this may decrease the chances of infertility. Also, very important thing is environment and our eating habits. So whatever we are eating today is full of pesticides. So one thing which is important, that we should opt for a healthier pesticide free or organic foods basically, which is also very important to decrease infertility. And we have to maintain a healthy environment so that we can give healthy environment to our children also. So we should reduce the use of plastics, we should reduce pollution. So whatever methods we can help the environment to save, these methods will also decrease the chances of infertility in people. So all these things is really important to decrease the chances of infertility.
Awesome. I think it was really, really informative. And I'm sure the kind of tips which you could have given, I think even if you try to implement 2 or 3, that will be really helpful for the ladies. So because these are very basic things, and adding to the pollution part and recycling and all, that really makes sense actually. A lot of people are educated, but they are not able to concentrate more on it. I think it's really high time, and people should actually be understanding the importance of such things, and they should rather, ignoring this, rather they should implement and get a benefit out of it. So thank you,
Yeah,
Dr. Kanchi. It was Thanks for your time.
thank you, Richa. Thank you so much for having me. Take care. Okay.
You
Bye.
too. Thank you so much.